Thank you. Hello and welcome everyone. This is Caleb from Tasc at the National Rural Health Resource Center. Today is Thursday, August 15th, and we are here for our August Task 90 webinar focused on the COPD resources recently created. We are excited to share the COPD guide focused on providing critical access hospital and provider-based clinics information and resources related to chronic obstructive pulmonary disease and some suggestions and tips on how they can provide some treatment and where to find resources should they need that. We have partner organizations such as ARCITA, the Flex Monitoring Team, the Federal Office of Rural Health Policy, and Rural Health Information Hub to provide updates on current projects and any news and updates. We have a federal, the Critical Access Hospital Regulatory Update from Carrie Cornejo from the Federal Office of Rural Health Policy. But we'll get started with an update on the Tasc happenings from Nicole Clement from the center. Are you there, Nicole?
Yep, I'm here. So to start off, the 2019 reverse site visit and EMS learning session presentations and materials are all online now. You can find those on the Tasc website in the right side navigation. Or you could also do a keyword search for 2019 RSV, or additionally, you could click the link that Andy just provided to find all of those presentations. They are all there and available now. Tasc is beginning the planning for the Octoberflex program workshop. The Flex program workshop is an orientation for those newly working with the Flex program. It's held in Duluth, Minnesota, and as soon as we have confirmed dates, we will let you all know with an email announcement. The Rural Community Ambulance Agency Transformation resource is now available also on the Tasc website. It includes a readiness assessment and resources for rural ambulance services to use to evaluate their readiness for transformation to a level of care that is people-centered and rewards positive patient outcomes through value-based payments. This assessment could be used by Flex programs to help assess the current state of ambulance services and to help with planning Flex activities in the EMS program area. Andy pasted a link to that also in the chat. And if you ever find yourself on the Tasc website looking for it, it is in the navigation in that lime green box on the right side. You could also do a keyword search for rural ambulance, and that would likely bring it right up for you in the search results. Tasc's Advanced Payment Models 201 Learning Collaborative is currently in progress. We have 13 participants from 8 states. The previous Learning Collaborative, which was the 101 version of that about advanced payment models, the recordings and materials will be available on our website soon, and when they are, we will be sure to let you all know. And that's it from Tasc. I think we'll talk about upcoming events at the end of the webinar. So that's it.
Yes. Great. Thank you very much, Nicole. Any questions for Nicole or Tasc updates? Hearing none, we will go to Carrie Cornejo from the Federal Office of Rural Health Policy for the Critical Access Hospital Regulatory Update.
Hi, can you hear me okay?
I can, thank you.
Perfect. Well, thank you so much. I want to give you just a few regulatory updates this month. There's been a lot of activity out of CMS. First, I'm going to start on the Medicare Inpatient Prospective Payment Rule, which was recently finalized and will become effective on October 1st, 2019. And there's some useful pieces of information here for critical access hospitals. The first is around graduate medical education. So in this rule, CMS is finalizing that now COGS may serve as non-provider sites for Medicare GME training in rural areas, or they may continue to incur costs as an approved training program and receive 101% reimbursement. There was another recent policy around CAW ambulance services. So CAWs can provide ambulance services and receive the 101% reimbursement for those services Even if there is another ambulance provider within 35 miles, but it's only in the case where that other ambulance provider can't legally provide transportation to or from the CAW. And the scenario that CMS provides in the rule is something where you're crossing state lines. If you have an ambulance provider in one state, but they're not legally authorized to provide services to the CAW that's located in another state, that would be an example where this would apply. Also, there have been some changes to the wage index, and while this is applicable to IPPS hospitals, I just thought I would mention it because it's notable, and it's a big change that CMS has put out this year, and there will be a positive adjustment for hospitals that their wage index values fall below the 25th percentile, and urban or rural hospital reclassifications will be removed from the calculation of the rural floor. There are also a couple of proposed rules I want to talk to you about today. First is the Medicare Outpatient Prospective Payment System rule, and comments are due on September 27th, and this would be effective on January 1st, 2020 if finalized. And the major proposal in the Outpatient Prospective Payment System rule this year is around price transparency, and there are a couple things that I would want to know, especially because they're applicable to CAWs. First, that hospitals would have to make public their standard charges for all items and services online in a machine-readable format. There's also a similar requirement to make standard public charges for a limited set of shoppable services, and this would be something that would be more of a consumer-facing, consumer-friendly document. There's also a request for information on quality measurement relating to price transparency, and there is a specific question there that's related to critical access hospitals. So if you're interested, I recommend you check that out there. Just also a couple more things on supervision of outpatient therapeutic services in hospitals and CAWs. CMS is proposing to change the general applicable minimum required level of supervision for hospital outpatient therapeutic services from direct to general supervision. There are also some policies related to 340B. This is basically a continuation of policies that CMS had put into place in the past for payment of 340B drugs. However, CAWs would not be included because they're paid under a different methodology. And the last one I want to talk about is the Medicare physician fee schedule proposed rule, and similarly, comments are due September 27th, and it would also be effective on January 1st. The biggest change there I want to raise is Medicare coverage for opioid use disorder treatment services furnished by opioid treatment programs. And this is typically, when I say opioid treatment programs, this is something that is regulated by SAMHSA, and it's typically called something like a methadone clinic. And so CMS puts forward a lot of the guidelines for how the payment would work for these services, and they also solicit public comment on any potential limitations on access to care in rural areas, recognizing that there really aren't many opioid treatment programs in rural areas. And then similarly, they're proposing to expand telehealth services related to the treatment of opioid use disorders. There's also a policy on ground ambulance data collection, and this is mandated by the Bipartisan Budget Act, and CMS lays out the guidelines how this would work beginning on January 1st. There's also a payment reduction associated with this, but CMS is proposing a process for a hardship exemption. There are also some changes to physician supervision requirements for physician assistants, and this basically is just to align the policies for PAs with current regulations on NPs. I also want to raise some updates to the quality payment program, since some critical access hospitals do participate in the quality payment program. Just some changes to the performance category weightings for the merit-based incentive payment system, and also that CMS is proposing to apply a new MIPS value pathways framework to future proposals for the MIPS program to simplify MIPS. And they're soliciting public comment specifically on some questions relating to the participation of small and rural practices. Just a couple of other items of interest. We recently published a guide. It's available on the HRSA website, and there was a webinar earlier today from the RHI Hub on collaboration in rural healthcare settings, and it's got a strong focus on critical access hospitals and federally qualified health centers. And it's also, I want to point you to an RFI that our colleagues over at the National Institutes of Health worked on with Veterans Affairs and the Department of Defense, and they're seeking feedback on telemental health services. And of course, if you have any questions, feel free to contact us at the rural policy at HRSA.gov inbox. And those are all the updates I have today.
Great. Thank you very much, Carrie. Any questions for Carrie from the federal office? All right. Hearing none, we will move on to Rural Quality Improvement Technical Assistance, or RQTA, as they're affectionately known. Carla, I believe, is providing updates, correct?
Yep, I'm on. Can you hear me?
I can. Thanks for joining us, Carla.
All right. We don't have a slide. I just have a handful of updates for you all. The first is just a thank you for those of you that provided comments on the MB-QIP performance standards. That comment period closed earlier this week, and we are working with F4HP to review what we received, and we'll continue to update you on next steps and plans with the MB-QIP performance standards. We'll have a particular update on the September MB-QIP virtual knowledge group. So we'll be continuing to circle around on what's next with those performance standards. We did just wrap up a pilot of the revised Emergency Department Transfer Communication Measure, or EDTC measure. And we shared a list of participating hospitals with MB-QIP monthly distribution. I think that was last week that came out. We had 30-some hospitals from across the country participate in a pilot looking at the revised measure specifications. And we're finalizing that. The revised measure information has gone into National Quality Forum for endorsement, and there will be more information coming this fall regarding educational resources to support the rollout of that revised measure. The official rollout of the revised measure for critical access hospitals as part of MB-QIP will start with January 2020 data collection. So that information will be coming out here in the next couple of months, with a push particularly later in the year for training on the new measure specifications. We're also in the process of getting a virtual quality improvement mentor program up and running. Thank you to all of you who submitted nominations for that. Everyone who nominated was applied, which was fantastic, but made our job actually quite challenging because we could only select 8 participants. So we just wrapped that up and have reached out to those 8 participants. They've all accepted. All of them were well qualified, and we ended up taking into consideration really kind of the geographic spread, years of experience, kind of the volume, system versus non-system based, to try to make those decisions. So we're excited to have those 8 excellent folks on board. We have a kickoff meeting with them at the NRHA conference, Critical Access Hospital Conference in September, and then we will have more information coming your direction from them. Our hope is to utilize them as a resource to provide input, expertise, strategies. We're hoping to do definitely some MB-QIP monthly newsletter articles, hopefully some podcasts. So we'll have these 8 kind of really enthusiastic, seasoned QI folks that we can utilize as a resource to help spread information and help support improvement across the country. And then the last update I have is on antibiotic stewardship best practices. Actually, I have 2 more updates. Sorry, we have 2 new resources coming. We have antibiotic stewardship best practices in critical access hospitals. We held focus groups kind of late spring, early summer, and those that information resource will be coming out soon. And then we also have shared here in the past, we have launched a new quality improvement basics online module or course that is available free of charge for anybody to utilize. It was developed with rural providers in mind. It's not specific to MB-QIP. It's really kind of broad QI basics, but it was developed with rural in mind. We have a facilitator guide that will be coming out with that. So if that's something that you're interested in utilizing, taking a group of folks or critical access hospitals through a QI basics course, there will be a facilitator guide that would help you do that. So that will be forthcoming in the next month or 2 as well. I think those are my updates.
Great. Thank you very much, Carla. Any questions for Arquita or Carla? Hearing none, we will move to Megan Lahr from the Flex Monitoring team.
Hi there, everyone. This is Megan from the Flex Monitoring team. Just a couple of updates and no slide for us either. We have just started a new grant year in July, and so we have a new set of projects that we're working on. So we may be reaching out to some of you to get your feedback or information or input. One of them is looking at the use of COG cohorts for quality improvement activities. We'll also be looking to assess the feasibility of implementing the FMT rural relevant EMS performance measures. So some EMS agencies may be involved with that. Another project is assessing community engagement, and a specific portion of that will be looking at social determinants of health programs, and so we've already reached out to flex coordinators, so we'd love to hear back from some of you we haven't heard back from yet. We will be looking at assessing financial indicators in COMPASS to see if there are any that we need to retire, look at adding new indicators in there, and then also looking to see if we need to revise some of the benchmarks that are used. And this spring we also completed an enhancement of our COMPASS data tool, which hopefully all of you have seen. If not, please check that out, and feel free to let us know if you need any login information as well as if any of your hospitals do. And we're always looking for feedback on future improvements that we could be doing on COMPASS, and so feel free to reach out to us as well on that. And then we also have several new products coming out in the next couple of months. We'll have a policy brief looking at the integration of mental health services in rural health clinics, a policy brief on the role of critical access hospitals in addressing the opioid crisis, and one as well, or a couple of them, on evaluating flex financial, operational, and quality interventions. And so those should all be out in the next couple of months, and that's pretty much all that we have.
Awesome, great. Thank you, Megan. Any questions for the Flex monitoring team? Megan? All right. Excuse me. Hearing none, we will ask you guys to please complete the polling questions of this webinar as well as the others. We like to make sure we are providing beneficial, relevant information and education for you guys. And we do that via polling questions prior to and post the webinar, and this is prior to the education portion of the webinar. And we'll get started with Kay Miller Temple from Rural Health Information Hub in just 1 second. As we're completing these polling questions, I'll draw everyone's attention to the link that Carla put in the chat box to the QI Basics curriculum that she referenced during her update. So a couple more moments so everyone has an opportunity to complete the polling question. Okay, I will use this moment to introduce Dr. Kay Miller Temple. She's a web content writer for RHI Hub. She is boarded in internal medicine, pediatrics, and hospice and palliative care, and writes from a perspective gained from many years practicing in rural and urban locations. She covers a variety of rural health topics and programs for the Rural Monitor and the section on models and innovation. She has a master's degree in journalism and mass communication. Thank you for joining us, Dr. Kay Miller, and thank you for sharing some of our resources. We thought or some of your resources. We thought it'd be great to have a partner organization share some of their resources related to COPD as well. Are you there? Star 2 will unmute your line. If you're speaking, Dr. Miller-Temple, we're not able to hear you. Excuse me, she's typing in the chat box. All right, well, wait just a second as Dr. Miller-Temple gets connected to the phone line. Thank you, Andy. Oh, great thought, Andy. So if you did not have an opportunity to complete the polling questions, Andy has put them back up there for us. Once you get dialed in, Dr. Miller-Temple, it'll be *2 will unmute your line.
How's this?
There we go.
Working?
Welcome.
All right.
It is.
Well,
thank you for joining us.
Thank you for having me, and I'm sorry for that little technical glitch. I'm working out of a hotel room as we are speaking here. So on to the second slide there. So RHI Hub has several resources we hope you all will find useful, especially for the professionals who are working in the chronic lower respiratory disease space, specifically COPD. An easy way to locate the resources for these topics on our website is just to search using the more inclusive taxonomy phrase, chronic lower respiratory diseases. That search will bring you to this screen where you can more specifically navigate your search. So I'm going to walk you through some of our categories now. Next slide. As a content writer, of course, the Rural Monitor is one of my favorite resources. This feature contains in-depth stories with a lot of data references that provide general education around the topic, perhaps helpful for grant writing or anybody just needing general knowledge and an update about what's going on with COPD in rural areas. In August 2017, our first COPD story came out, Bringing Change. It is a comprehensive story that reviews the original congressional request of the CDC and the NIH to begin specific work on the disease that at that time was the third leading cause of death in America. The story shares the collaborative work of those federal agencies that culminated in the COPD National Action Plan. 5 stakeholder groups are spotlighted, and the rural touch points are outlined in this story. You'll also note I've listed 4 additional stories there, ranging from rural occupational lung disease to a Q&A with patient advocate associated with the COPD Foundation. And in the near future, we hope to publish a story that's focused on the patients in rural areas that have COPD and yet haven't been identified. Next slide. So, as a reminder, our Models and Innovation section includes rural programs, some with evidence-based rankings, that have impact on identified rural health problems and written so the program's information can be quickly scanned as to the program's services, its results, and suggestions for how you can replicate it in your own area. For COPD, there are several programs with patient-centric activities that improve quality of care and quality of life for COPD patients, and these are located across the country. In West Virginia is the Grace Ann Dorney Pulmonary Rehab Program in multiple communities in that area, providing outpatient community-based pulmonary rehab. And associated with this particular model is a journal article that proves that the outpatient community-based pulmonary rehab is as effective as hospital association pulmonary rehab. This program's evidence is effective. The Ohio Readmission Prevention Program and the Oregon Inpatient Navigator Program focus on care coordination, patient education, and identifying patients who qualify for pulmonary rehab. And last is the Mobile Screening Program in New Mexico that serves a population that is about 40% Hispanic and 30% American Indian in the remote areas in the Southwest. This program also has an effective evidence ranking. Next is our toolkit section. Toolkits are step-by-step guides for building effective community health programs. And though none of these toolkits have the specific phrases COPD or chronic respiratory diseases, the information in them can be used, translated, and applied to COPD. For example, the toolkits that might be helpful are the Care Coordination Toolkit, the Tobacco Control and Prevention Toolkit, Networks and Coalitions, Health Promotion and Disease Prevention. They all have information that will be helpful for any organization wanting to work on the impact of COPD in their communities. Topic guides. Similarly, our Chronic Disease in Rural America topic guide has useful information applicable to COPD with its section on chronic respiratory disease. It also provides a general overview and data on the topic. An excellent webinar from March of this year included expert commentary providing an in-depth perspective on COPD in rural America. Please note that in 2017, RHI Hub had the privilege of hosting 5 webinars covering the CDC's MMWR Rural Health Series. Several of those touched on COPD and chronic lower respiratory diseases. Those webinars are archived, they have slide decks, and they have full transcripts. We have a RHI Hub YouTube channel, and you'll find a video overview of COPD in rural America that we just uploaded in May. And in this video, experts discuss the high prevalence rate of COPD in rural areas, some possible causes of the disparity, some treatment options, and how we can better address this disease in rural areas in a collaborative fashion. Our new resources section located in our online library, again, is one of my favorite RHI Hub sections because here you can get a quick list of recent reports that are coming from a variety of organizations and also rural news related to COPD. And last is everyone's favorite, funding. Again, part of our online library, a variety of funding sources are indexed and have a clear designation as to whether they're active or not. We continue to host that inactive funding information because many of these opportunities will reopen in the future when funding is again available. And you'll notice that the phrase chronic lower respiratory diseases or COPD is not specifically in some of these funding titles, but the grant's intent may still focus on a population with those diseases. Okay, in closing, I'd like to remind everybody that we are not just an email away, we are a phone call away. And pictured here are our 4 information specialists who provide assistance. We love getting your emails, we love getting your phone calls, and it is our great privilege to provide you with assistance. Never hesitate to reach out. My contact information is there, our 800 number and email info specialist email is there. And thank you again for having us participate in this webinar.
Great. Thank you very much, Dr. Miller-Temple. Do we have any questions for Kay or RHI Hub? Both the chat box and *2 to unmute your line. All right, thank you very much. And for everyone's reference, all of the slides today are available down in the lower left-hand corner of the webinar window to download, and the recording will be available on the Tasc website shortly. All right, so I want to talk a little bit about the resources and efforts that have been that we've been working on here at Tasc. A reminder that the National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities as the nation's leading technical assistance and knowledge center. In rural health, we focus on transition to value, collaboration, partnership, performance improvement, health information technology, as well as workforce. So we provide technical assistance through Tasc to the 45 state Flex programs. We offer a resource network for the Flex programs for information, knowledge sharing, best practices, as well as assisting Flex programs in building capacity and supporting critical access hospitals. I just realized we're going to have to update this slide as it says Flex grantees, and we're now going to be cooperative agreement participants. Last fiscal year, which started in September, we were provided a supplemental project focused on COPD, and the goal of that was to provide some resources and address rural disparities in COPD. And the things that we identified that we thought would be helpful or most helpful from our organization would be a guide to the Flex program specifically, but to the critical access hospital secondarily to that, as well as a podcast series. We thought as technology is changing, podcasts are ever more an avenue that people utilize to gain information and updates on what's happening. So we'll get into each one of these as we go. And this is the third of 3 webinars that we created. And then Lindsay from Stroudwater will discuss the COPD/pulmonary rehab assessment that we sent out to critical access hospitals through Flex coordinators. So all of this stuff is available via the Tasc website, as well as all of the other resources. But we have a special COPD resources and efforts page where all of this content, as well as additional resources from partner organizations such as RHI Hub, can be found. The National Action Plan is available there for download and review. The webinars that I referenced just last slide and we'll talk about here in the next slides to come are available there. The podcast recordings are all available there. So it's really a one place to go for all of the COPD-related resources on our website. So when you go to our website and search COPD, all of the things that we've come up with will be there. And this is what we are really here to talk about. Lindsay will discuss this in a bit more depth, but overall the purpose of this guide, as you can see, is to provide information about chronic obstructive pulmonary disease and clarity about some of the best practices of care management for those with COPD in rural communities. It discusses the incidence rates, and but it goes really quite a bit beyond that to discuss some of the financial or reimbursement opportunities that are there. Oftentimes when we hear about a disease or a topic, we're not really able to provide resources on funding opportunities or updates on that, but in this guide, Lindsay and the Stroudwater folks were really able to provide a lot of help and guidance on that. We're really excited about this manual. We tried to keep it manageable. It's about 50 pages, but we really hope it'll be useful to you guys as flex coordinators to understand what's going on out there in rural America, and more specifically what you guys as flex coordinators and hospitals can do to help support your hospitals, specifically rural health clinics and small rural hospitals beyond that. The first of our 3 webinar series was on April 2nd, and that focused on the impact and prevalence of COPD, of chronic obstructive pulmonary disease. We had Christy Martinson, the director of the Hospital State Division from the Federal Office of Rural Health Policy on, as well as Grace Ann Dorney-Koppel, who we were happy and honored to have participate on our work group that we will discuss or reference later. And Lynette Johnston from the Pennsylvania Office of Rural Health Improvement Coordinator to provide some perspective from the patient side of things. Both Grace Ann Dorney-Koppel as well as Lynette's brother have COPD. So it was a great webinar to talk about the patient's perspective and how what can be done and how that affects patients. The learning objectives are there for you to see, understanding the personal impact, national initiatives, as well as the state level efforts from Lynette. And then we followed that webinar up with the finance webinar to really discuss the financial aspects and topics surrounding COPD care, the importance of providing rehab care, and as well as examining some of the reimbursement opportunities that are there, some of the coding specifically. Again, the link is in the slides that are downloadable, and that is available on our website. The podcast series is something we're really excited to do. We started with Grace Ann Dorney-Koppel, from the former president of the COPD Foundation, president of the Grace Ann Dorney-Koppel Foundation, to talk about the incidence and importance of COPD care. It was a great episode. I really enjoyed it. If you've not had an opportunity to listen to that, please follow the link as soon as we're done with the webinar, of course, and take a look at that. We have 2 more episodes that will be released shortly. One is a small rural hospital, and one is a critical access hospital. And we are talking to the hospital administration about pulmonary rehab and providing pulmonary rehab care to their patients, both with and without a specific pulmonary rehab program. We talked to Dr. Dan Doyle, a provider who's been providing in rural West Virginia for, I believe, over 30 years, who is also a member of the work group who we relied on for review, discussion, and guidance on all of these projects. Michelle Collins is a respiratory therapist in Maine, providing care in rural Maine. We thought that would be a great addition, and we could not be happier with Michelle and her perspective, as well as Paul Moore from the federal office to discuss both his experience as a pharmacist as well as his perspective from the federal office. And then Lindsay and Lori Daigle from Stroudwater discussed again some of the financial aspects of COPD care and how you can in quotes, get reimbursed for providing some of this care. So they're about a half an hour in length, and we're really excited about those. We worked with Dr. Bill Oxtier from Rural Health Leadership Radio, who, again, if you've not had an opportunity, please do check out that podcast. It's a rural health leadership podcast, and it's quite entertaining and very informative. And then, again, reference the COPD Pulmonary Scope of Services Assessment. We really, really appreciate your guys' support as Flex coordinators in disseminating this assessment. We worked a lot with Stroudwater and Lindsay from Stroudwater to create the format of this assessment, as we did not want to waste anyone's time in asking questions that we could research on our own, but we wanted to get a real good understanding of what the care provided throughout the country is in the critical access hospitals and what that looks like, the format of it, how many hospitals are providing this care, and what that looks like in rehab or not. In total, we had a couple duplicates, which was really very exciting that we had more than one person from a facility completing this assessment. So that means that showed us that there's a great amount of support and interest in this topic. We had 345 responses, and that is phenomenal. We are very, very excited to get that response. So we really do thank you as Flex coordinators for disseminating that and sending that out to your hospitals and partners, as you as Flex coordinators are the only people we sent that link to. So thank you very much again for that. And Lindsay, who will speak in just a second, will discuss some of the findings of that assessment, and we're really excited about it. The work group, as I've referenced, we, again, could not have done it without. We had a great group of people that I was very honored to work with. Dr. Doyle, Dr. Moscovite, Carla Wang, Dr. Mark Lindsay, Susan Michelle Collins, Pat Scow, Lynette, Grace Andorni Koppel, Dr. Uden, Omi Balut from the federal office, Paul Moore from the federal office, Christy Martinson from the federal office, Tony, Dr. Tony, thank you for your time, as well as Nail, Carla Wilbur, Kristen, Lindsay, Terry, and Sally. Thank you all very much for your time. We had a great group of people here that helped provide feedback on the draft, on multiple drafts of the assessment, or the guide that we'll see in a little more depth here in just a second. But this group of people alone to get into a group and talk about something was great. So thank you all very much for your time and dedication to this topic, as well as to the center and Tasc. That was a lot and very fast. I wanted to make sure we provided enough time for Lindsay to talk about the guide as well as the assessment, as I feel that will be the primary place for questions. Lynette from Pennsylvania wanted to make sure I point out the great resource such as the CPT ICD-10 codes that are specific to COPD patients, and that is very helpful to hospitals and rural health clinics. And yes, thank you, Lynette. What other questions or comments do we have before we send it over to Lindsay at Stroudwater to discuss a little more in depth on the COPD guide and assessment findings? *2 will unmute your line.